Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope you're doing well today. Here in my office, one of our laboratories where we do a lot of our, if you will, scout work, taking care of people. Just give you a new visual perspective here than in my medical personal office where we do all our consultation stuff. So listen, today I had actually, things sometimes come in twos and threes, and today I did a lot of conversation with patients about erectile dysfunction and sexual dysfunction, particularly in men. And so I thought there's a good opportunity to kind of bring some things that are sensitive topics, very relevant topics that touch and affect many men, young and old, and definitely as we decade by decade progress with age, can have a pretty emotional, stressful, psychological, relationship-related effect on you as an individual and on a couple. And that is erectile dysfunction and sexual performance issues, and that, particularly in men. So of course here at Longevity Health Institute, we always look at you in functional systems. We always want to treat the underlying cause and look at root causes. So of course we're looking at stress effects, psychological, emotional effects, the mind and body connection, even related to libido and erections. Actually, statistically, they say that after the age of 50, 50% of men in studies, 50% of men have erectile dysfunction at age 50, okay? That's how statistically significant it is. It's believed to be somewhere between 70 to 80% of sexual dysfunction and erectile dysfunction is actually due to psychological reasons, emotional and performance-related issues. But there's other reasons. But I just wanted to review with you a couple things. You want to consider certain systems and certain things that may be causing this. Okay, one is that there is the emotional part, okay, of erections. The connection, there's studies on this even related to the emotional connection and the physical connection between the two individuals. But stressors, performance anxiety issues do affect an individual. Once it happens once, there can be completely 100% related to psychological apprehension versus actually anything that's physiologic or functional related to blood flow or hormonal with erections. So when a man can't get an erection regardless of age, we have to think of emotional system, stressors, we have to think of hormonal related issues, and we have to think of blood flow, okay? So one thing I always want to rule out, and I always think of somebody with erectile issues, and a man, regardless if they're 30, 40, or 80, I want to make sure and clear them for anything cardiac related, meaning because there is a relation, obviously, if you have poor circulation and poor blood flow that gives an erection, it's possible that there's some cardiovascular issues. There's small studies, yet significant studies that show that even in young men that have erectile dysfunction, that there's a pretty high correlation when you're under the age of 30, that it is related to some vascular or cardiovascular risk. So you do want to think of that, you do want to screen that out. So all the men out there or wives or partners out there that are listening and receiving this, please share this with your loved one, with your partner, with your spouse, because they may have something that they're not really appreciating that's cardiac, and that should be evaluated, okay, completely. So once that's ruled out and evaluated, you would want to make sure that you consider one of the bigger common symptoms, okay, and that is the stressor effect that I already mentioned. The emotional turmoil, stressors in their life, mind-body connection, cognitive things that could be affecting. Once there's a performance issue, some of the emotional stuff has to be addressed, whether it's therapy, cognitive behavioral therapy, or you're just the partner, just the two of you getting together so that your sexual partner understands what's going on, you're open about it, there's some open intimacy about this sensitive topic. Aside from that, we do have to think of hormonal issues. Hormonally, there's a few major hormones that play a role, like testosterone, DHEA, an adrenal hormone, estrogen, okay, and then related to the first thing I was talking about, stressors do affect your adrenal system and affect cortisol. So if you have an issue with cortisol, with imbalance in testosterone or deficiency in testosterone, or your testosterone to estrogen ratio, or you have issues with your cortisol or an adrenal hormone that does deplete with age called DHEA. These are all possibilities that they can affect erections. Now, in my experience, a lot of it is the libido, the drive, the stimulus that affects the person when they have hormonal dysfunction. But there is some studies and some relation to that the hormones also drive erections. The interesting part is this: you can have somebody, and I see this all the time, that has very low testosterone, and I mean in the hundreds, in the lowest quartile that we see, even regardless of age, and they'll have no performance sexual issues at all, no normal erections, no sexual issue at all. So remember, hormones are personal. That's why we approach hormones very in a personalized way. But just remember that these have to be considered. The other thing is the vasculature. So you've ruled out vascular issues, you've ruled out something cardiac-wise, but on a microvascular issue, related thing, the corpus of the penis actually has these tiny vessels, and I mean they're like pinpoint thousands of vessels that fill the corpus of the penis, if you will, shaft. And the thing is that these are very easily damaged, whether structurally damaged with sex, whether they're physically structurally damaged because of sports or athletics or injuries with age. Okay, those can be damaged, and then the blood flow can be compromised throughout your adulthood. But that is something to consider. Okay, so certain things, drugs that are called PD-5 inhibitors, like Viagra, Cialis, and that vasodilate. They increase the amount of nitric oxide that's in your body. Actually, it inhibits the reabsorption of nitric oxide. So the more nitric oxide, the more vasodilation, and thus the better erection. And these are very effective, and I know you've heard of these. Fortunately, these are also now generically out. When they're generically out, cost goes way down. So instead of $25 a pill, you can actually get them for $1 or $2 or $3 a pill. And they're very effective. When that fails, there is some injections that are hormonally and vasodilator driven, and they have to be taught, but they're basically localized penile injections that within minutes give you good circulation and blood flow. In general, all of these are safe, these methods, but they need to be handled very personalized, and they need to be educated to the patient, side effects, risks, things like this, but they're all minimal, and they can all be alleviated as long as there's a good doctor-patient relationship, which here at Longevity Health Institute, we always go over this, even though it's a sensitive topic. I think it's very, very important to handle, and also very important to be open about and to even discuss with your partner, with your spouse, with your sexual mate, because these are things that make intercourse and sex and a relationship beautiful, wonderful. So, cannot be dismissed, I think, and overlooked. There's studies on that. There are medical studies. We live longer and healthier with a better sex life. So remember that. But these are the things we have to consider, and consider them in a very personalized way, which is what we do here, me and my practitioners. And you want to rule out the worst first, and deal with the cognitive and the psychological stuff, because that's very common. And yes, sometimes we do use these PD-5 inhibitors, these vasodilators, even when it's psychological, because it crosses that bridge of performance anxiety. And as long as there's no negative downside or side effect, or something can be minimized, everybody wins. So hopefully this enlightens you on the treatments and the reasons, and a little bit of insight, a little snippet of erectile dysfunction and hormonal play and the functional issues related to this. There are natural things that can help out sexual issues related to erectile dysfunction. Yes, counseling, cognitive behavioral therapy, I already mentioned, does help. A sexual therapist can help with this. I personally believe you and your partner, if you're open about it and discuss these issues, that I notice in my practice, that is definitely something that helps. And I have a lot of husband and wives here and partners here that I see, and so it's something that I think that is very, very helpful. On the other natural end, I think that there are some things, And in my experience, it's not wonderful, but there's some natural things that you can try. Increasing your L-arginine, which is an amino acid, actually can help nitric oxide pools, which can help erections. Adding niacin, a B vitamin, can actually help vasodilation and help your erectile issues and help blood flow. There are some things you can take naturally for prostate health, which can help subtly, and that's like saw palmetto and diindomethane or indo-3-carbinol, which are in vegetable extracts that we can go over with you. I personally find probably the best thing that's helpful, because it helps circulation in your whole body, lowers blood pressure, helps muscle recovery with exercise, and that's beetroot extract. So beet powder, beet supplements are wonderful for this. But when I say wonderful, they're not as effective as the medication like a PD5 inhibitor. So again, hopefully this is a snippet of enlightenment for erectile dysfunction and sexual performance for men. Yes, it's a sensitive topic. I think it should be embraced and not shunned on and embarrassed about. Actually, it can be a wonderful thing to life and relationships if it's approached. So again, always personalized, always looking at the systems, always looking at the details is why you get well. So this is Dr. Lewerenz, Longevity Health Institute. Hope that educated you. Have a great evening. We'll see you again.